You know, a lot of times the transgender community is not significantly highlighted in mainstream media. But today, I'm very excited to be able to chat with someone who is directly assisting and helping and giving attention to trans needs right now during our COVID-19 pandemic. I'm joined by Dr. Bella Avanessian, the Assistant Professor of Transgender Medicine and Surgery at Mount Sinai. Good morning, Dr. Bella.
Good morning. Thank you.
Thank you. I know that you're in New York. You're there in the epicenter of the COVID-19 pandemic right now for the U.S., and you're working specifically at the Mount Sinai Hospital with trans patients. Can you tell me this morning, how has COVID-19 directly affected the trans community?
So, in a lot of ways, the trans community was very hard hit by the cancellation of all elective surgery. And I think just calling it elective surgery was a blow to the community, because the surgeries are not exactly elective, but that term is used to when we talk about anything that's a scheduled surgery. So a scheduled and planned surgery in the surgical world becomes known as elective. But all of our surgeries, by definition, were canceled, along with all other similar surgeries of different urgencies, including cancer resections and transplants. So
Okay.
It was very difficult for the trans community to have a surgery canceled, especially for them, who a lot of the bottom surgeries in particular take lots and lots of planning. You essentially have to plan to put your life on pause for a period of about 3 months. And oftentimes that also involves either a friend or a family member who will also take a pause with you to help with the aftercare. So I think it was a very heartbreaking thing to have a surgery postponed. And on top of that, to not have a definite answer of when we'll be back to operating, back to seeing patients normally.
Right. With this kind of heavy emotional toll that's being put onto the trans community, are there any types of resources for mental health or coping that the hospital or that you're seeing are being provided?
So there are actually, we get a number of emails and reminders daily, and I'm happy to share one of the emails that provides resources for patients. But there are resources specifically at our Center for Transgender Medicine and Surgery for patients, both ones who have established mental health care with our center, as well as anyone who either doesn't have a mental health provider or just needs some support during this time.
Mm-hmm.
Additionally,
Go ahead. Additionally, yes.
Additionally, we do get emails about resources for mental health and well-being for all of us.
Mm-hmm. Dr. Bella, you work directly with trans patients, and you've done that for a number of years. Can I ask you, what led you down this path? You were one of the first to graduate from the fellowship program for trans medicine and surgery at Mount Sinai. What led you down that particular path to work in this field?
Sure. So it all started when I had my first exposures to transgender surgery clinics, or excuse me, to transgender medical clinics. I thought of the transgender community at one point as a senior in my plastic surgery training, and wanted to use one of my elective months to basically find out more about it, because for some reason I was drawn to the patients and to the field. And my first exposure was to transgender adult outpatients in medicine. And my next exposure was to transgender kids and teens, and they're the ones that I found incredibly compelling. And it's just such a warm and amazing feeling to hear their stories and to hear the experience of their parents and the changes that their parents go through when they allow their child to transition. So the patients really reinforced that, yes, I do want to get involved and work with the community. And then my first exposure to transgender surgery came right after that, when I visited Pierre Brassard in Montreal. And he was amazing. And the surgeries were just so interesting and complex. And I was drawn to that. There was a lot of creativity and art that really goes into making things symmetrical and beautiful, but also it challenges you as a surgeon to basically follow all of the principles of plastic surgery and respect the tissues and tissue planes and perform beautiful dissection, keeping everything safe. So that's when I knew I really wanted to get into transgender surgery, but my focus at that point became on how to do this and get proper training so I could deliver safe and effective care, which I think is very, very important.
Well, speaking of safe and effective care, with regard to COVID-19, a lot of members of the trans and the LGBTQ community, but specifically the trans community who may have been on schedule for surgeries, some of them may be affected directly by COVID-19. Will their having of the virus or even, survival of it, will that affect their timing for surgery? Will it affect their ability to have surgery? And how can they best stay safe?
So that's an excellent question. And I wish I had exact answers for you. Right now, the situation with the virus is so fluid, and we're doing our best to follow the hospital, state, city, and federal guidelines in terms of how to respond properly. I think right now the safest thing we're doing is abiding by the stay-at-home measures and really limiting live patient visits. And that prevents exposure to some degree. I do worry about some of our patients, especially our HIV positive population or anyone who is immunosuppressed for any reason, as potentially being at higher risk. We don't know exactly what it'll mean when we're allowed to resume surgery and resume patient visits, and what additional things will be required of patients. We have heard that patients will need to be swabbed, the nasal swab, which I don't know if you've experienced, but it's an uncomfortable test.
Yes.
They're advising for that to happen within 2 days of surgery to rule out a potential infection. And that test in itself is not perfect and doesn't always pick up the virus, even if it is there. So it's hard to say. And my other worry becomes, as a provider, if I somehow contract the virus, potentially asymptomatically, and how I will put others at risk just by my interaction with them.
Mm-hmm. Well, yeah, us living through this pandemic is definitely giving us a lot of sometimes uncertainty, and we're having to kind of pivot in order to live in this new normal. I know personally at home, you're living in a new normal as well with your children. Tell me, you're a new mom. As a new mom, and this will be my last question, as a new mom, what are your concerns and how are you addressing those? And how is life at home for you right now?
I will say that life is very special in all of the time that I get to spend with my family, but also incredibly challenging.
Mm-hmm.
And that's for a number of reasons, including we don't have our nanny come. We typically have a nanny 5 days a week. We love her. She's a member of the family. But in order to keep her and her husband safe, we're actually continuing her salary, but keeping her safely at home. And then for us, it becomes tough as two parents who are continuing to work from home in a small confined space with two young kids.
Yeah, I'm sure there are a lot of parents out there who will identify with your situation as well. How are you making that work?
So I will say there's a lot more screen time, unfortunately. It's tough to provide an enriching experience, especially with the parks and the zoo and all of our typical outing activities closed. It's really tough without play dates and interaction with other kids. And it's hard for example, my toddler who's 2.5, it's hard for her to understand why she can't see her friends except on FaceTime. But we're making do. We're reading books, we're building puzzles, we're watching TV, we're cooking and baking together. And it's funny when you see a 2.5-year-old who typically wants to touch anything and everything in sight, and instead she's not touching a thing when we're out of the house, and also instructing us not to touch anything.
You got a smart one on your hands. I love that. Well, thank you so much, Dr. Bella Avanessian. Thank you for joining me, and thank you for informing our listeners and viewers on a lot of things directly affecting our LGBT and specifically our trans community with surgeries. Thank you.
Thank you so much for having me.
Of course. Have a nice day.
Thank you, you too.
Bye.
Bye-bye.